The OCTA Research Group is tracking a higher number of new COVID-19 cases than initially projected. Let's discuss that with research fellow Professor Guido David. Good afternoon, Professor Guido. Thank you again for joining us this afternoon. First off, how much more COVID-19 infections per day are we seeing vis-a-vis your expectation? And will you have to revise your end-of-month estimate of 6,000 cases per day, you think?
Yes, hi, Sean. Yeah, we were looking at our earlier projections made in February 17, and in those projections, we were seeing about 3,000 cases in NCR by the end of the month, and about 5,000 or more cases in the Philippines by the end of the month. And the basis we used was the reproduction number, which we projected using a value of 1.6. This is about what we saw in Cebu when it had the surge. Now, based on tracking, so we were looking at the daily cases in Metro Manila compared to the previous projections. And based on the previous projections, we were supposed to hit 2,000 cases in Metro Manila by around March 21 or 22. And right now, we already hit 1,975 cases in Metro Manila yesterday. So it's almost 2,000. So we're basically ahead of the timeline by around 10 days. And when we looked at the projections, we revised it with a faster trajectory using a reproduction number of about 1.8. And this is more or less in line with what we're seeing, because right now the reproduction number is around 1.8. It's 1.86, in fact. And the number of cases are sort of matching this newer projection. And based on this, we're going to be seeing 4,000 cases at least in NCR by the end of the month. It could be that, an average 4,500 cases. And in the whole Philippines, maybe 6,500 or 7,000 at least.
All right, in line with these increasing numbers and the increasing trend, do you plan to change your projections and propose stricter restrictions to the national and local governments?
Well, of course, that's the decision of the national and local governments. We presented our projections to these bodies, and we will see. So far, we're having localized lockdowns in Metro Manila, and we're seeing that there is some effect of these localized lockdowns on the trend. So it's slowing down the trend at some level, but we're seeing an increase occurring in many LGUs right now in Metro Manila. And now, in fact, not just Metro Manila, but we're also seeing increase starting to happen in places like Rizal, in Antipolo and Cainta, and in places like in Cavite. So that's also an additional challenge, because it's not just happening right now in Metro Manila. And there's also something going on in Santa Maria, Bulacan. I mean, an increase also starting to happen. And these are significant increases. These are not just upticks. And we have to start mitigating them soon. And we hope that the Metro Manila, the local government, the Metro Manila Council will take steps in, really slowing down this uptrend that we're seeing.
All right. Of course, we don't have the genome data all in yet, but can you say now, or can we finally attribute the spike to the new variants being present here in the NCR as well as other places in the Philippines?
I think we can safely say that there is some level of transmission that involves these variants. So far, we have identified 2 variants in Metro Manila, the UK variant and the South African variant. Of course, we will need genome sequencing to confirm these, but right now, based on the trends and how fast the numbers are increasing, we strongly feel that this is driven in part by these variants, because we did not see this kind of rate of increase before when we were just dealing with the previous variant. So the rate of increase strongly suggests that there is a variant involved, and both of these are very infectious variants, at least 50% more infectious. And now new data is showing that they are not just infectious, but they will cause 60% more higher mortality based on I think over 1,000 samples looked at in the can't remember. I think it's in the United Kingdom. So that's also a real concern, because 60% mortality would mean more deaths. And if the variant is involved, definitely the mortality rate will increase.
Yes, that was the study done by the British Medical Journal, but bringing it down over to the Visayas, how is the situation in Cebu? We did manage to speak with the spokesperson of the DOH Region 7 earlier this week. She said that they're doing well in terms of lowering the daily infection rate, at least in Cebu City. Any other hotspots in the Visayas and Mindanao that you're seeing, of course, outside Luzon?
Actually, the situation is really good right now in Cebu City. We're happy to report that they were able to slow it down. In fact, the cases are decreasing now in Cebu City. It's also decreasing in Lapu-Lapu. It has slowed down in Mandaue. It's not yet decreasing, but it's basically trending almost flat now. It's also decreasing in other places in Cebu, like Talisay. So the situation is really good. And also in Davao City, they're now just averaging as many cases as, almost as many cases as San Juan. So Davao City is now just averaging 23 cases per day. They are now close to being categorized as low risk if they bring it down a little further. So the main concern right now, aside from NCR, parts of Calabarzon, and parts of Central Luzon, we're still seeing an increase in Baguio City. It's not that fast, so I think like those might be just clusters of cases. So we'll know more as we monitor these.
All right, that's certainly good to hear, but we also have some more alarming news, some LGUs, of course, saying that transmission at household level is definitely increasing. Do you guys have any available data on this?
We speak to some of our doctors in the team, and we have anecdotal data on increased transmission in households. But what we have seen is that there is definitely an increase in transmission or infections for minors, for those aged 0 to 17, and the numbers have increased significantly. And I think this is supporting evidence that there are more household transmissions, because we know that minors are generally not allowed to go outside. So I think this is indirect evidence of household transmissions.
Yeah, definitely something that can be inferred or deducted. Now, what can households do to effectively prevent the spread of COVID-19 within, a space that everyone feels should be their safe spaces?
Yes, that would be a real challenge. I have heard of, I'm not sure if it's, being thrown around, the idea of requiring face masks in households. I don't even have an idea how that could be implemented. I mean, even if we have that, but that would have been something, at least, to stop household transmissions. I think we just have to accept that, in households, if someone gets infected, well, the risk is really high of other people getting infected because of sharing spaces and utilities. One way is, we can have, if someone gets sick, they can get quarantined in a quarantine facility. Again, I can't really say if I would recommend that one way or the other. I think those are definitely parts of the challenges of dealing with this very infectious variant, which is able to transmit better in households.
All right, yes, you're right, Professor Guido. We have spoken to an infectious disease expert who also suggests masking up inside the homes. Thank you, as usual, for your time, for your insights, Professor Guido David of the OCTA Research Group.